You're listening to the Knowledge Archives podcast. Welcome to the Knowledge Archives podcast. We're a group of students on a mission to learn from as many different disciplines of knowledge as possible. I'm your host, Madhav Malhotra, and today I'm pleased to be joined by Dr. Mike Irvine, Biostatistical Lead at the BC Children's Hospital Research Institute in Canada. He has years of experience in studying mathematical biology, especially in regards to using mathematical modeling in epidemiology. And thank you for joining me today. I really appreciate you taking the time, and I'm very excited to keep learning about your work. I guess before we get started with all of the complicated details, it would be great to just learn a little bit more about yourself, your story, and how you got started with this area of work to begin with.
Hi, I'm Dr. Mike Irvine. I'm the Biostatistical Lead at BC Children's Hospital Research Institute. And part of my background has been broadly focused on mathematical modeling of infectious disease as well as other particular kind of public health interventions that we would like to sort of model and understand.
Yeah, and I am very glad to hear a little bit more about this field because I certainly hadn't heard about it anywhere before this. And even just looking into the basics, it was really fascinating for me to actually hear about the history of using math and modeling in epidemiology. I remember hearing stories of early scientists in the field just tabulating records of newspapers and doing it very informally, and now we have all of these more complicated methods. So that really intrigued me, and I was wondering if we could start off by learning a little bit about where the status quo of this type of modeling is at.
Mm-hmm. Yeah, I mean, it's an interesting field in the sense that maybe for approximately 100 years or so, people have been coming up with these kinds of modelings, these kind of quantitative approaches to look at and understand infectious diseases. So, I mean, one of the pioneers within this was, for example, is Ronald Ross, who actually received the Nobel Prize for his work to identify the malaria parasite, to understand that mosquitoes were integral in the transmission of the life cycle of malaria. And he also actually did some work around modeling of malaria itself. And so understanding then how this life cycle of the mosquito then leads to the dynamics that you see with malaria, because in malaria, it's a seasonal disease where you'll see it sort of come over the summer, and depending on the climate of the location of where that exists. And so being able to sort of use some key kind of principles to break those down, and then to be able to kind of quantitatively construct a model of it, you're able to explain quite a lot of this kind of behavior. And so really today we're using tools which were kind of established, I'd say developed, sort of from that kind of that period back in time, maybe sort of 100 to 50 years ago. And as you say, back then, of course, there were these kind of records of outbreaks and things like that, but maybe not quite in the same level of detail that we have today. But having said that, the principles kind of remain the same. And so the types of modeling, the strategies that we have, I would say broadly haven't changed very much in the last 50 years. Really, what has changed is our interaction with the data and maybe the types of questions we're asking of the models, and then how we apply those models themselves. So when we think about, say, an infectious disease, if we imagine simply that there's a population of individuals and everyone is equally susceptible, say, to a new infection, and of course, this used to be something where we'd have to sort of imagine a scenario like this, but now we're kind of living through it right now with COVID-19. And so what happens then is obviously there's some introduction, there's some new case, but then from that, there are these secondary cases. And those secondary cases are related to, one, how transmissible the infection is, and also two, how long that individual, that primary case, interacts with other individuals, how many of those individuals and for what length of time until their infection is concluded, until their infectious period is concluded. And so we take this principle, this concept that there will be some susceptible population, there will be some interaction between the infected individuals and those individuals who are susceptible, as well as how transmissible the disease is. And essentially using that, we come up with this idea of what's called a SIR or SEIR model. So these are compartmental models where we can basically break down the whole population into different compartments. So we're saying that an individual, say for example, they'll either be susceptible, infected, or they've recovered. And if they've recovered, that means that they can't get infected again. So what we're doing is to essentially, we know that biology is very complicated, and we know like the biology of any disease is very complicated, but we distill it down to these sort of very core principal ideas that there's a population out there who are susceptible, some will be infected, and then the infected individuals will interact with the susceptible people in a certain way. We create equations of that, and then that allows us to then describe the whole process of the epidemic of the infection. And so actually, based upon these quite simple models, we could describe broadly quite a range of behavior. So this idea around that after a certain point, there will be a shift between the number of susceptible individuals and those who have recovered, such that we would then no longer see this kind of sustained classical exponential growth, and you would start to sort of see a decline. We also understand this idea around this kind of nonlinearity, whereby after a certain point, if a disease is transmissible enough, then we know that there'll be an epidemic that will take off. But if it is not above a certain point, then we know that epidemics should decline over time. And so these kind of modeling approaches have been applied broadly in the past. And really what's happened in the last 10 to 20 years has been sort of further refinement of those kind of modeling approaches, as well as incorporation of data so that we can try and adapt those models a little bit better to the kinds of questions that people in public health might be asking.
Mm-hmm. And in regards to that, so I know you mentioned a few key ideas, like knowing the number of people who have been infected, how that compares to the number of people who still might be susceptible. Are there any other key observations you try to draw out from these models?
So some of the kind of classical results of this, and think about the classical results are that they're good as sort of general rules of thumb, I'd say. We can add in complexity to this, and I could talk a little bit more about the kinds of complexity we add to it. But as you do that, then so the answer changes a little bit as well. And then if we add more complexity, we need to think about what data we can use in order to justify that component. And then adding additional data might increase our uncertainty of that result. And so we could do these things and derive these things, and they're good to sort of really understand broadly what's happening. If we're thinking about sort of our local situation, our particular disease, we have to try and make these kind of adjustments and refinements in reflection of what that situation is. But so just with that caveat, one of the kind of key things you can look at, say, for example, is if you're able to estimate in the beginning what the transmissibility looks like, sometimes called the reproductive number, you're able to, say, for example, understand what the total attack rate would be for an epidemic. So that would be the total number of individuals who would be infected once the epidemic has concluded. And so you could then understand that given this initial growth, how much of the population do we think is going to become infected with this? And so that gives you sort of an initial key idea of understanding just how big of a problem, say, something could be, because in the beginning you only see say a few small cases, but the modeling allows us to do that kind of wider inference to say over the course of this whole epidemic what potentially could happen. So I mean that's one result, right? You can use that initial growth to then try and understand what's going to happen if you just allow the epidemic to run its course without any intervention. Some of the other things you can do as well then, which has been discussed a lot recently, is related to herd immunity. And so herd immunity itself, it's not trying to describe how we get to that point, but it's saying there will be some point at which once we've reduced the number of susceptible individuals, either through them becoming infected themselves or through a vaccine, say, for example, then there will be a critical point after which the epidemic can no longer sustain itself and it will decline. And so again, we can, based upon these sort of early transmission estimates, we can understand what broadly that might look like. And so again, this gives us a kind of a nice indicator to say, if say we were developing a vaccine, then what proportion of the population would need to have received this vaccine before we would start to then see the epidemic kind of brought under control.
Mm-hmm. So I very much appreciate you describing that in a very simplified way. I could tell that there is a lot of additional things that we have to consider. So thank you for giving us an overview. But also, maybe it might be helpful for you to think about, say, you were doing your research on is this opioid kit going to be effective? And walk us through some of the problems you encountered. Maybe there was sparse data, maybe there was a few issues with uncertainty.
Yeah, so I mean, I guess just reiterate that point you mentioned around, really the kind of mathematical modeling. What we're trying to do is we're trying to extract some kind of key principles that we believe is happening within the system, and then use those to make inferences. So, say for example, we have a vaccine or we have an intervention. We know how effective this has been within a small population, and we want to make general inferences about, well, if we applied this to the whole population, what should the overall impact be, given that there's some interaction there, say, for example, between susceptible and infected individuals. And so, really, mathematical modeling, I'd say, for things like public health and infectious disease is quite diverse because it sort of changes depending upon the context of what's being applied. And as you mentioned, like the kinds of data that you can use and things like that. So it ends up being that really you've got to sort of try and that the model and the methodology has to kind of fit the question. And so, yeah, one of the things I have researched in the recent past has been understanding the opioid overdose epidemic, principally within British Columbia. And so, one of the initial challenges with this idea is that, as I say, but with an infectious disease, what you do is you try and understand something about the biology of that infectious disease in order to understand, say, how one individual case leads to secondary cases. And so, if you understand that, then you could try and model it, and you can think about what that epidemic curve looks like. In the case of opioid overdoses, where we're particularly we're looking at, say, illicit drug-related overdoses, one of the things that we can't sort of directly understand, or is very difficult to understand, is how different contaminants. So you may have heard of things like fentanyl, which is a very potent opioid, which has become a sort of a dominant contaminant within the overall illicit opioid supply. How things like that end up leading to the overdoses that we observe month to month. There are some data around it, but as you can imagine, it's a very difficult thing to really sort of generally obtain data for, because of the nature of it, right? It's a illicit drug. But the things that we do observe directly are things like paramedic attended overdoses, as well as deaths that are related to overdose. And in particular, of those, we could see of those deaths, which of those were related to, say, for example, fentanyl. And so, within the context of this, one of the things we really wanted to understand was how these interventions were having an impact on these overdoses. And if those interventions hadn't taken place, how much worse could it have been, given that, we were still seeing sort of very high, and in fact, still are seeing incredibly high number of overdoses month to month. So that meant that we had to sort of look at the data that we had access to. And as I say, those were these kind of downstream things once we'd observed those overdoses that were observed through reporting and those deaths. And to think that month to month, there is this force which is driving the overdoses principally through fentanyl contaminant within the illicit drug supply. So what we did then was to come up with a model such that we're trying to estimate that level of fentanyl contaminant month to month because we don't have direct access to it. So this is under the category of say like a latent state model. So it's latent as in or hidden because we don't observe it directly, but we observe the downstream effects of it. And so we're able to come up with a construction of this model to say that we're saying that there's this kind of dominant month to month force which is driving the overdoses, and that will have some impact month to month on the number of overdoses we see and on the types of overdose death that we observe. we can then use this latent space model to then try to fit what that state looks like month to month. And then once we have that, then we can start to understand, well, if there wasn't the fentanyl contaminant in the supply, so these questions around having, say, a safer supply, what would that have looked like if we could turn back time and change what had happened? And obviously, the other thing that we really focused on were naloxone kits. And so naloxone could help resuscitate someone who has had an overdose. If we know the number of deaths that had occurred and we try to estimate the total number of overdoses that had occurred, then we can try and understand what the risk associated with a uninterrupted overdose would be, resulting in a death. And if we could understand that probability, then we could say what impact these naloxone kits had. Again, by sort of if we could turn back the clock and say that no naloxone kits were distributed, then understanding what that kind of probability of death following an overdose would look like if there were no naloxone kits, we could then sort of play back over time and see how many more overdose related deaths there potentially could have been.
Mm-hmm. I think it's very fascinating to hear about all of these details involved, and it makes me then think about the content of this field, what is actually being done, versus the context where now you might derive a result for how does the naloxone kit help in this situation, but then the context is it's being done to make public health decisions. So I was hoping to hear a little bit about the environment there. So what types of practical applications are usually made with this kind of data? And are there any key barriers?
Yeah, for sure. I mean, it involves a lot of collaboration, obviously, between a variety of stakeholders, this kind of work, and both to try and understand as much as possible the context of the system that you're working in, and to understand the, say, for example, the limitations of the data. What is it that potentially could be missing from that data, and what else do you need to account for within the modeling? So all of those things. But I'd say, principally, as a modeler, as a scientist more broadly, your goal is really to try and collect this data and make some inference about the wider situation. So you work closely with policymakers, with stakeholders, to understand what are the range of scenarios they might be considering, or what are the key questions that they're trying to understand. And so once you have those as your kind of research objectives, then really your goal is to faithfully as possible use that data, use your understanding of the system to then present those results. And I think there's kind of two things there. One is that models will always have assumptions necessarily baked into them. And that's because we have this kind of huge complex system that we need to make some inferences about. So we need to make some assumptions about what's happening there. How do these data relate to each other? How does the biology, say, impact a disease and things like that? We need to distill that just to some key ideas. And of course, we could keep adding complexity in to try and get more realism in, but there's only a sort of a finite amount that we can do this, and it's dependent upon the data that we have. If we don't have data that we can fit to it properly, then we try and simplify as much as possible, because we still get the same kind of general principles out without having to make extra assumptions around sort of various intricacies which we don't directly observe. So really, it's sort of the communication, the challenges there might be. And the other thing as well is when you incorporate data, of course, in your estimates will have uncertainty. And this is one of the things that we find at the moment, in communication. There will be a point estimate, which we're saying is the most likely thing that could happen. But within that as well, we have a range of potential scenarios that might happen. I mean, to use a recent example, say consider the recent US presidential election, where some particular kind of companies were trying to do kind of simulation modeling to understand what the likely outcome could be. And some of those scenarios could have, say, for example, gone the other way, or could have been very close. And it's hard, right, to communicate that, to say, we're trying to make some inferences about the future, and we will only observe one of those potential scenarios. So there's this kind of code of uncertainty going forward in time of all these sort of different scenarios that could potentially occur. Some are more likely than others. And so being able to sort of communicate that effectively, I think is always a sort of a challenge. And I think you have to think of sort of ways to visualize that and understand what does that really mean, right? We're not saying that we know guaranteed we know what's going to happen in a month or even in 2 weeks, but we can, we can say under these assumptions, under these limitations, these are the range of plausible scenarios that we are likely to see.
Yeah, I think one of the key barriers is we in the public have a limited understanding of statistics relative to mathematicians. And finally, to wrap up this podcast, I wanted to ask one quick question, which was regarding the future of the field. What are some new ideas, technologies that are being developed that can advance this field? And what are some open questions that we still need more work on?
Yeah, so I mean, so go back to the beginning, right? We're using a lot of techniques which are sort of very well established. Really, those are the kind of foundational kind of modeling approaches we're using. I mean, I see a number of different directions where we're sort of going. Obviously, there's a huge influx in diversity as well as size of data. And so developing better tools in order to incorporate that data effectively into models is one key thing which I think is developing further. And so for an example of that, you could look at things like Bayesian analysis, which is a particular kind of statistical model fitting technique, which used to be quite complicated to implement, and you'd have to be sort of pretty specialist in order to do it. Whereas now there are these tools out there which allow you to sort of fit these more complicated models within a Bayesian framework. And that's useful because it allows us to incorporate our prior understanding of things like, if we have previous estimates, say, of different epidemiological parameters, we could incorporate that within our model fitting within our data as well, to then end up with some probability, some estimate, which should hopefully incorporate not only our data, but our previous understanding of the particular system as well. So I see that sort of being developed more, and I see it in multiple different areas of incorporating that further. And the other is the types of data that we could incorporate. There have been some cases of say trying to sort of put in things like social media data, things like that, to understand patterns of behavior broadly, to understand if we can use this as part of sort of symptom onset, the incorporation of genomic data, say for example, within these to understand these chains of transmission, to understand say who most likely infected who, and if we can understand those chains better, we can then start to sort of model better in different settings where infection occurs. And I think as well, one of the other things, we have these model structures which are sort of in place, which provide that understanding of how a disease is communicated between individuals. But the things that we really do quite badly is to understand human behavior more broadly. How does human behavior impact that? Some of the things we could do there is to actually incorporate things like machine learning methods to try and encapsulate all of that sort of human behavior data that we might have access to publicly or otherwise, and incorporate that in with our transmission modeling to understand a little bit better, to maybe try and predict a little bit more accurately in terms of what the likely course would be based upon how people are modifying their behavior in light of, say, an epidemic.
Yeah, I think it's really incredible to hear about all of these very different areas of development. And I think that for people who are just getting the first exposure to this field, I think it's exciting to hear about how these fields like machine learning that are becoming more accessible to more people, they can be integrated into these advanced fields that maybe someone hadn't heard about before. So I am going to be very much excited to keep updated with this field and seeing how these technologies continue to help us and get better at doing so in the future. And I really appreciated you taking the time to walk us through the simple details here, because that does present another kind of challenge beyond the complicated work that you do already.